Cerebral palsy. That there is a disorder with the brain which is permanent and oftentimes present from birth onwards, but it is not getting worse. And the book says that the likelihood of having then a lower IQ as the general population is higher, but that there are many people who have it who have then average intelligence or even above average. And the book says that some people with it also have university education. And the book then encourages and says that people with it can have oftentimes an enjoyable and fulfilling life, and also the people living with it. And that is according to the Family Medical Advisor by Keith Hodkins, written the year 1982 on the page 101. But this is no substitute for medical knowledge and also no medical advice. The positions and views expressed are the ones of the source and don't necessarily align with our or the ones of entities spoken. Hi and welcome. I'm trying to learn medicine today, cerebral palsy, and after we've done it, we're going to do extensor carpi ulnaris strength training. And if you participate in the extensor carpi ulnaris strength training, then it's at your own risk. And this is no medical advice, also no substitute for medical knowledge. I'm just trying to read it and to understand it. And the book is written in 1982. Cerebral palsy. That is a term, and the term is the term cerebral palsy. And it indicates a permanent disorder of the brain that is usually present from birth, but that is not getting any worse. What does the word palsy mean? If I remember correctly, it is facial palsy, which is that the face is not moving or something. That the face is immobilized. It's not here. Okay. Now it is known that there is a brain disorder, the disorder at the brain, which is permanent from birth, but not getting worse. It is usually present from birth, so it could be also later, we say. So cerebral palsy, it is permanent, but not getting worse, and most of the times at birth. Many so-called spastics suffer from cerebral palsy. So we didn't have it yet. I don't know if it is or somewhere. No entry. Not here. So it's probably something else called. So they say some people which are here written in quotes called spastics have cerebral palsy. Although more children with cerebral palsy have lower IQ than the general population, an individual person may well have average or above average intelligence. The likelihood that a person with cerebral palsy has a lower IQ as the general population is higher, but the individual with cerebral palsy could also as well have average or even above average intelligence. With the support and encouragement from family, friends and teachers, exceptional successes can be achieved. For instance, some sufferers have completed university education, and some people with cerebral palsy, for example, as named in the book, have completed a university education. Despite their problems, cerebral palsy sufferers can live enjoyable and fulfilling lives, as can those who are caring for them. And the book is giving some encouraging words, saying that many people with cerebral palsy can live an enjoyable and fulfilling life, and also the people living with them. The term is occasionally used to describe a paralysis that follows any stroke. Is it not the same? We're not going to mention it. Okay, cerebral palsy, that is The term cerebral palsy indicates a permanent disorder of the brain. So it is a permanent disorder of the brain, but it is not getting worse. Most of the times they are from birth. The likelihood of having a lower IQ is higher, but many people with it have an average IQ or even above, and some people, for example, have some people who have it have also a university education made. And the book is encouraging them then that the sufferers or the people with cerebral palsy can oftentimes live an enjoyable and fulfilling life, also people living with it. Okay, cerebral, I don't know how to pronounce it, so cerebral, I'm trying it out. Cerebral palsy, cerebral. I would say cerebral, but I would have pronounced it way stronger with on the C in the beginning. And way harder, the whole word, all the letters. But starting with cere, it doesn't make sense to say with bra, cerebral. So, cerebral. What was it even though I still know it? Cerebral palsy. That there is a disorder with the brain which is permanent and oftentimes present from birth onwards, but it is not getting worse. And the book says that the likelihood of having then a lower IQ as the general population is higher, but that there are many people who have it who have then average intelligence or even above average. And the book says that some people with it also have university education. And the book then encourages and says that people with it can have oftentimes an enjoyable and fulfilling life, and also the people living with it. And that is according to the Family Medical Advisor by Keith Hodkins, written the year 1982 on the page 101. But this is no substitute for medical knowledge and also no medical advice. The positions and views expressed are the ones of the source and don't necessarily align with my own or the ones of entities spoken. That was the medical part. If you are here for medicine, you can go to the techniques of medicine. There we're going to read on. If you stay here and participate in the extended couple hours strength training, that is with your own risk. Have a good and still stand. Arms up, hands from the fists, and bring them down. And up. And down. And up. And now the hands like that. And again down. Strong fists. So press the fingers together. We are having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we go only as far as we can go with a little bit of effort. And the third rule is that we're not overdoing it, we just want to strengthen, not to exhaust. And now you can use a t-shirt, a towel or a sock, press onto it and down. Press evenly with all 5 fingers. And now again. And with your hand. Press and up. And up. And with your right, press and to the outside. And your right, and press and in. One more time. And with your right, hold top now, and stop. And up. other hand, press and hold. And just press in neutral position and on the other side. And that was the extensor couple analysis strength training. I thank you very much and at the next time.